Health insurance exchanges are new health insurance marketplaces in each state, which serve as the foundation for the expansion of access for the majority of uninsured in most states. They can be operated on the state level by a state. They can also be operated in a partnership form, which is a partnership between the Department of Health and Human Services and the state, in which the state assumes functions either related to plan management, plan certification on the one hand, or on the other hand with respect to consumer outreach and enrollment. Or an exchange can be fully federally facilitated, and that means facilitated by the Department of Health and Human Services in terms of consumer outreach and enrollment and plan management and function as well. So of the 6 New England states, 4 have been conditionally approved to operate a state-based exchange, and those are Massachusetts, Connecticut, Rhode Island, and Vermont. The state of New Hampshire is going to operate in a partnership model. So for states that are have been conditionally approved and are seeking to operate their own state-based exchange, they have undergone a very rigorous application and review process, working very closely with the Department of Health and Human Services, and continue to receive technical assistance and in a very close relationship with the department. And the expectations are that those states, with the funding of the department through its first year, will then be able to operate self-sustaining marketplaces where individuals and small businesses will be able to access a variety of new options for health insurance, and individuals, whether purchasing coverage as an individual or as an employee of a small business, will have access to advanced premium tax credits up to 400% of the federal poverty level. It's exciting to think about where health insurance exchanges and health insurance marketplaces in each state are going to be in 5 to 10 years. We have only the experience of Massachusetts to see what the opportunities are that are presented by such a marketplace. It certainly represents the promise of access and consumer protections and very strong support statewide for people who enroll, individuals and small businesses as well who enroll in the exchanges. But creating this marketplace where there really are the new rules that are being implemented under the Affordable Care Act, as well as a new one door and no wrong door entry for people to be screened for eligibility for insurance products, whether they're private products or whether it turns out that they're eligible for a state program. This is an important place for people to have a single point of access and for there to be trained assistance for them to be able to enroll. And that's really the key to sustainability of coverage for the individuals and the small business employees.